In this episode of 340 Banter, we're joined by Matthew Krah, Senior Solutions Engagement Director at Verity Solutions, a third-party administrator in the 340B program. Today, we delve into TPA housekeeping and reviewing the different elements that covered entities need to perform regular maintenance and upkeep on to ensure an optimized and compliant 340B program. Let's talk TPA housekeeping and maintenance. I know that many covered entities have to work with more than one TPA at a time, and it can be really challenging to make sure that the TPAs continue to work properly or that the data continues to interface properly. So let's start off there and kind of talk about your experience dealing with multiple TPAs and your experience in trying to help covered entities to maintain, a compliant and optimized program.
Yeah, I came from a health center and we had 5 TPAs. So it's a lot of data coming in, and I'm coming in from a retail background and didn't know what I was looking at. So it was a big learning curve trying to interpret all the data. And one of the big things is the data is very different depending on what TPA you're looking at. So
that's a full-time job to manage 5 TPAs.
Yeah, luckily we had a full-time person. We were fortunate because of the size of our health center, but a lot of health centers don't have that. And it can be a lot, even before you start talking about auditing, just managing the data and getting it compiled for the finance team into one manageable file is challenging every month.
And that's from a health center perspective. From a hospital perspective, you toss in having to manage, different crosswalks and package sizes and billing units and all of that.
And GPO provisions and all of that. Yeah, that's a lot.
Yeah, and I think one of the challenging points from a vendor perspective is when customers are on the set it and forget it type of mentality, right? So
340B runs itself, doesn't it?
It does. There's no hiccups ever. Nothing ever changes. It's very status quo. But what we've done, the approach we've taken is we do a business review for all of our clients. So if you participate in it, awesome, right? We want you to participate. Mm-hmm. If you don't participate in it, we're still doing that business review and we're storing it in our CRM system. So
is that like when they come on board or quarterly or monthly?
Bi-weekly.
Oh, wow. Okay.
Wow.
Yeah. Yep. And it's typical, accumulations, top wax spend, data feed errors that we see. And it's really nice to have. So like in your position, when you take over a new position at a health center, right? You could go to your, if you were using Verity, come to us and say, hey, what have been the last 6 months of business reviews looked like? And at least that helps bring you up to speed if nobody else was actually paying attention.
Yeah, that's great.
So set it and forget it, I think, is one of the biggest challenges. Another challenge is, some of our legacy customers might be using an old data spec, right? So if you wrote a data spec in 2016, well, a lot of things have changed back then, and we've got a lot of optional fields in our data spec. So you're not getting the full advantage of all of our audit report fields if you don't have everything in there. So I
imagine in that time, even like the EMR fields would change as well, the medical record fields, and I've
seen people that didn't fix their EMR feeds and they have new sites that aren't feeding into their TPA.
New locations or new encounter types that aren't coming over in the files. If it's been almost 10 years since they set up the feed with the data spec.
Yep. And I think there's a different philosophy on those locations, right? Like, so some of our customers just do their own filtering before the data even comes to Verity. And then others are using our location filtering. Now, what's kind of nice if you're using our location filtering, at least you can see there's 200 locations that aren't, crosswalked and are showing as inactive. So that might be like a little trigger of like, okay, maybe we should do something.
But more challenging if they're filtering ahead of time, but they don't necessarily know that they're filtering new ones out.
And at least with health centers, they often don't have, if they have IT departments, they're not very expansive. So it's hard for them to identify those challenges in their data feeds.
We actually had a situation recently with one of the EMRs was filtering all Medicaid encounters for all of the patients. So if you were registered as Medicaid, they weren't even sending us those encounters. And the problem with that is was Medicaid actually used at the pharmacy at point of sale, right? So we don't need to be actually carving that patient out. So again, without actually looking into the why are we filtering this? Why are we not sending this? You could really be losing out on a lot of opportunity. And I think it was on Halloween we got that nice surprise from the government that medical claims are now included with the rebate.
340B rebate, yeah.
Well, guess what we had to do? We had to update our data spec in Verity to be able to digest that. And if you're not looking at your data spec and asking your TPA what changes are coming, should I reevaluate this? We're not going to be able to help you submit medical claims if we don't have that HCPCS and unit of measure data. So.
And even that, I think, is challenging for some covered entities. Just the elements for the 340B rebate piece, looking at the HCPCS and unit of measure are probably relatively easy to pull through. However, they're like the claim line number is not something that necessarily is accessible or sendable, but it is a field or a value that needs to be present in order for the claim to pass that front end validation. So being able to then speak to your vendor to say, okay, if this isn't something that we have, how can we work to have it populate? It needs to have a digit. It needs to have an integer in that field. And as long as you can trace back that claim, because that's what that claim line number would indicate, as long as you can trace it back or it's identifiable, you can kind of work through that. But being able to work with your TPAs, plural, to make sure that you've got that information both going in and coming out is important.
I didn't like working with 3 when I had to, so I couldn't imagine working with 5.
Yeah, 5. I quickly downsized as quickly as possible, and we still have 3 at my health center. So it's challenging, but when you're sometimes you don't have a choice, or you come in and there's some of those older legacy TPAs that you struggle to get rid of. But it creates challenges, and it's really important that you think about that. And when you're staffing your 340B program, is that you have to be able to manage all that data coming in, and it can create some additional staff workforce.
I think another great example we have of data being filtered out on the hospital side is billing for waste.
Yes.
And that's important with the rebate model too.
It's going to be big for the rebate model. It's going to be big for 340B, and it's huge for reimbursement. So it's going to be really like a 3-way hit if you're not getting that right. Mm-hmm. And I often say that we can bring the drug in at 340B all day long, but if you're not getting paid for it, what good is that?
Yeah.
And we had a scenario where one of our customers was buying a ton of Remicade on whack, like 90% of it. And it was, small doses. It was a pediatric unit. And what was happening was there's just a lot of waste. So we worked with them, did like a 9-month reconciliation, got a data upload of all those claims. And then like their 340B went, through the roof because they had all that backing of the waste. So waste is really something that I would also say, like, look into it. What's your waste policy? Work with your revenue cycle director. Are you actually billing for waste? Are you putting the right modifiers on it? So there's a lot beyond just getting the drug in at the best price. We really need to make sure we're getting paid for it as well.
And I mean, along with that is, some people will view that as, oh, well, that's us working the system or getting away with something, but it's not. You just have to make sure you have the the records to be able to demonstrate or back up the 340B behind it.
It's definitely within the rule set. My background prior to 340B, I did a few years in revenue cycle, and it's definitely permitted by CMS using that UD modifier. There's policies out there that are publicly available, pretty easy to find with a Google search. Look at your top payers. If you're in an area that's dominated by a blue, look up that local blue and what's their policy on waste billing, and most likely it's going to follow what CMS says. Put
your
a UD
Medicare
modifier
JWs.
on it.
Yeah,
or JW. Thank you for correcting me on there.
He was like, that's Medicaid. But
that's wrong.
Okay.
Yeah, I got my modifiers mixed up.
Yeah, I think that's really important because sometimes the waste is not unavoidable. It's because of dosages. So you might as well be doing that documentation. But I think that really brings up a good point that 340B is not a pharmacy program solely. It requires working together with your finance team, your billing team, your IT and EMR teams that you really have to get everyone together so you can manage that program completely. And that goes for the TPA as well, because you have these data feeds, and maybe it's a nursing manager that's making sure that those waste codes are being put in there correctly.
Yeah, I'm a big fan of a well-staffed steering committee for the 340B program. In one area you missed too, I think government affairs. I think that's really important to have at the table. Like, let's be proactive with this stuff, and let's not wait till there's a crisis. And finance can help with that. Revenue cycle can help with that. So I think it's definitely a multidisciplinary approach for a really strong, successful 340B IT as well. Having IT at the table.
So thinking about the entities that may be struggling or facing challenges with managing their TPAs, or they're not sure if they're making, they're keeping up on all the data elements. I'm wondering if we can kind of go through two lists more or less for people to be able to use as takeaways from this. One, I'm thinking, is what elements should they be looking at with their TPAs on a regular basis? And then when they're selecting a TPA, what questions should they be asking? It's tough when you don't know what you don't know. So what things should you go in to that negotiation or conversation hoping to get out in terms of just understanding the program to see if it fits your own covered entity?
So, I'll start with, one easy thing that I think could be, a starting point of where to dig in a little deeper to try to find if there's issues with your program, is looking at your accumulator and sorting by the negatives and anything that's excessively positive. Because if we've got excessive positives, that to me says we've got a multiplier issue, or we don't have a price in our catalog. So every order is getting split to GPO or getting split to WAC and not actually being purchased on 340B. If it's excessively negative, what happened there, right? I had a situation once where a pharmacy tech with very good intentions in one of our own pharmacies would go into Cardinal and buy a generic equivalent anytime something was out of stock. Awesome. I love that you're buying the best price, but we don't have the accumulations to back that, right? So you gotta make sure that you're focusing on that. And then when it comes time for shopping for a vendor, I would say rely on your peer groups, right? Don't just take the sales rep's word for it. Everyone's gonna say that they're the best, but can they actually prove it? So use those conferences again, networking, ask for references from who you're evaluating. And I think that, all TPAs can build a 340B bucket, right? But where areas that I think are distinguishable is the amount of support that you're going to get from that TPA, because after that contract signed, what's the quality of implementation like? What is the quality of the support that you're going to get after implementation? And a lot of that is publicly tracked by external firms outside of the TPAs. So Class Research is one of them. You can go in, you can look at all the TPAs and how they stack up against the competition. Cybersecurity is another huge one. I myself got like a $30 check from a breach that I was involved with from a hospital back in Pennsylvania, and that bought me about a muffin and a Starbucks coffee. So, but it is a real threat, and you want to know what is your TPA doing to keep your data safe, because the last thing you want to do is be on the front page of a local newspaper that there was a data breach from your health center or hospital.
What kinds of things, like how would a covered entity know that their TPA has proper cybersecurity measures in place?
So there is certifications out there that are available. SOC 2 is one that a lot use. That's more of a financial type of cybersecurity certification. And then there's High Trust, which is the more of the healthcare sector type of cybersecurity. And Verity has High Trust certification. I will say that is one of the more challenging and more expensive certifications to get. So you want to know what kind of security measures are in place, and that requires us to have all different kinds of policies and procedures, notifying our customers of any breaches. They test our staff regularly. We get phishing attempts all the time, and we have to submit the phishing report and get a pass or fail, and they actually track those rates. So getting to know that, and then know what kind of cybersecurity coverage that they have, right? Someone can say, oh, we'll give you unlimited cybersecurity insurance, but if you don't have the funds to back it, it's really only as valuable as the ink that the paper's printed on. So, I think that's a pretty good pretty good. What's your service like? What's your reputation like? And what's your cybersecurity measures?
And one of the things I've done and I've talked to other covered entities about is you mentioned references, but it's also valuable if you find references that aren't given by the TPA as well, and find them through maybe Nautopod for the health centers or the 340B Health exchange, where you can talk to other people in covered entities and get a reference that may not be provided from the vendor, because you'll get possibly more of an honest review of the program. And I think something I did that's really simple, doesn't require any Excel skills because I have very minimal Excel skills. When I was looking through the reports, I would do a simple look each month at the tracking of the number of claims captured, because I could easily see if there were anomalies. And we would have a month where we drop 500 claims at a certain pharmacy, and I know, okay, there's a problem here. I don't know what it is, but it clued me in so I could ask the questions. And that open communication with the vendor partner is really important. You may not need to know what the problem is or how to fix it, but knowing who to call and start those conversations.
Ghostbusters every time.
Yeah.
I agree. And I think another easy way to identify where there may be a problem, even if you don't know what's causing it, is periodically pulling your electronic prescription report from your medical record to see how many prescriptions are going out to each pharmacy. And while that won't factor in if you carve out Medicaid or you've got manufacturer restrictions there, it will provide you with more or less a comparator for month over month. We've been sending about this many prescriptions to this pharmacy, and we've had about this many qualify. And if there's a change that's not reflected in the other number, then being able to say, okay, is there something wrong with, are we qualifying based on prescriber NPI? Do we need to update the provider list? Are we qualifying based on location ID? Do we need to update any locations? Kind of using that as a starting place to be able to dig more for a root cause analysis.
And most TPAs have a feeds monitor of some sort, right? So that's one of my go-tos as well. Like if I've got a customer that sent us 20,000 line items overnight and 900 processed, something's wrong there, right? We need to fix that. So I would also recommend looking at that too and see how many of your files are actually processing versus rejecting or duplicating.
Yeah. Well, thanks so much, Matt. It's been really helpful to go through this.
It's been fun. Thanks for having me.
Yeah, it's been great.